My name is Chris Reagan. I am the director of the McGill School of Public Policy at McGill University. Welcome to today's installment of Policy Challenges During a Pandemic, a webinar series we've been running for the past, since we've been locked down. So I think we'll call that 5 weeks or something like that. For today's talk, I am delighted to have Kevin Page. Kevin Page has been in several places in Ottawa that have given him a great perspective and a great experience on policymaking. He spent a bunch of years at Finance Canada. He spent some time in the Treasury Board, spent some time in the Privy Council office. He then went and was the first parliamentary budget officer in the PBO. And for the last few years, he is the CEO. He's created and he is the CEO running the Institute of Fiscal Studies and Democracy at the University of Ottawa. And today, Kevin is here to talk about policy transparency during this pandemic. And without further ado, I'm going to turn it over to Kevin Page. Thank you very much for being with us, Kevin.
Thank you, Chris. So Chris has asked me to speak about the issue of policy transparency as it relates to the COVID-19 pandemic. And as Chris said, I'm going to talk about the broader issue of the challenges around policy transparency in a complexity seminar in the first week of June. So actually what I'd like to do today in my 25 minutes is I'll run you through a PowerPoint. But and the PowerPoint, basically, I'll start with this issue of complexity that Chris has highlighted, and that it plays an important role in the overall structure of training at the McGill School of Public Policy, and then kind of link it to policy transparency. I'll give you what I call a little bit of a framework to think about policy transparency. Then I'll provide some high-level observations around how how transparent policies have been in certain areas, particularly the areas of public health and the economic and fiscal supports that have become part of almost daily briefings from politicians in Canada and around the world. So that's the overall frame that I'd like to take you through. So I'd like to start with some quotes, and these quotes were again I like sometimes I like to kind of I pick these up over time, and the first one really came from an author that I've read some of his books on. One, really, The Art of Reading, this author Ulan, and he actually talks about this issue to me that kind of frames what Chris is and the McGill School of Public Policy is trying to get at when they talk about complexity. He says, if we frame every situation in terms of right or wrong, we never have to wrestle with, so I'm just going to change the screen, with complexity. If we define the world in narrow bands of black and white, we don't have to parse out endless shades of gray. So when we deal with these issues of complexity, as much as we're tempted to, we can't always say this is right and this is wrong. Often where we find ourselves is in that gray zone between right and wrong. And then a couple of quotes that I picked up just from different readings, in recent weeks from Financial Times. One is, from the OECD, William Hines. And Hines says, pandemics, they're not linear, they are exponential. When things get knocked off track, they don't always come back to a steady state. We are talking about complex systems. And to be honest, again, I think I'm probably guilty of, I am guilty of very linear thinking. And so this really, I think there's been an education trying to understand how public health people look at pandemics when they talk about things and things like epicurves. Then there's this quote from this author, Rana Foroohar from Financial Times, which really highlights, unfortunately, the way too often I think, which is, she says, much of the debate about how to reopen countries and cities in the wake of the coronavirus has, for example, been incremental. Very calculus way of looking at the world. Take away X amount of social distancing and get X amount of growth, and so on. It is as if there was some easy way to define numerical trade-offs between the two. Again, in these times of incredible uncertainty, how we kind of gravitate towards numbers, but also we struggle with linear thinking. And then finally this quote from a chief economist from the Bank of England, Andy Haldane. Both events, he says, and he's talking about SARS and Lehman Brothers failure, so really, an epidemic and a global financial crisis. He says both events were manifestations of behavior under stress of a complex adaptive network. Complex because these networks were a cat's cradle of interconnections, financial and non-financial. So, I mean, there's kind of three quotes that kind of talk about living in the world of complex systems, systems that are not linear, systems where there's questions about how we get back to steady state, and just, again, forcing us to think about all these interconnections. And then knowing that when in a complex world, it's not often about right or wrong. Often you're parsing shades of gray. So a little bit of a plug for McGill School of Public Policy's program. So, the students that are out there, again, you're looking at training programs that consist of 5 elements: core policy courses, policy case studies, skills workshop, complexity seminars, of which policy transparency is one, and a policy lab. And when I stop and think about it, I don't think you could find a better complicated, complex issue to discuss that's, we are living in, a historic one, this COVID-19 pandemic. And when you start to break through like the different policies or the different issues that are at play, like we're dealing on, again, and I think this is really the cat's cradle of interconnections, a global health crisis, incredible social and economic disruption. And here we are today, like doing this, not face to face, but, over the internet. Geopolitical stress. We turn on the news, we are, more and more hearing about stress between different countries, particularly the United States and China. A global economic recession, unlike, we've never seen before, many-fold bigger than certainly we saw in 2008. And public-private emergency responses. In public, certainly in the question of responses with enormous fiscal supports, but also, like, again, we're going to move quickly to kind of involve the private sector in terms of the reopening. So it is this perfect storm of complexity. And then, these big questions: when will the world turn to a steady state? And what would that steady state look like? What is the new normal? And what is right or wrong from a policymaking perspective when there's really almost no playbook? We have not gone through a modern pandemic in our lifetime. So, and then the bottom question, which is Ulan's question, the author Ulan, like, do we have any choice but to parse out endless shades of gray? So again, just now a little bit of a framework around transparency. Like, how personally, from my perspective, how do I look at it? And you may look at it differently. So, I mean, the basic definitions of transparency are the ability to see through. And it's kind of the definition that I like best. It's simple. Can we see through, policy? And the key components when you look at the literature are things like openness and honesty, very practical kinds of words. Our government, our public health officials, our government officials, our business leaders, are they being open with us? Transparent with us? Are they being honest with us in terms of frank exchanges of what they know? In some cases, are they being fact-based? And then, like, to me, when we put this more in a policy context, I tend to be kind of, as Chris said, I'm more of a bureaucrat. We tend to look at it in terms of different dimensions. One is strategic, the other is operational. And by strategic, I mean when governments are launching these big programs, they obviously have an end in sight, and we'll talk a little bit about today. It could be a flattening the epi curve, so to speak, the infection rates, or it could be putting significant amounts of monies out the door through a wage subsidy program, so that when the economy does start to pick up, that this disconnect between small businesses or businesses and in the labor market is not so disconnected. And so, yeah, those strategic objectives, those performance outcomes that they're trying to achieve. And then the operational, as we get into this very shortly, like, we've never, in my lifetime, I couldn't imagine the kind of amounts of monies that are going out in fiscal supports and through liquidity supports. And these are just, astronomical numbers, even when compared with the 2008-9 financial crisis. So enormous pressures on government departments to provide monies for workers through EI programs or emergency response programs or wage subsidy programs, or for students as well. So again, the ability, the transparency from a more the mechanics of governments providing these types of monies is to me, like, are we being, is an element of transparency. And then the number of policies that are at play, particularly when we're talking about COVID-19, are multifold. There's the issue of health policy. Obviously, first and foremost, we're dealing with a health crisis. Then the supports, social, economic, monetary policy kind of supports, which we'll talk about. And then, broadly, the fiscal policy issue. And, as the PBO and others have highlighted, IMF, we're about to see significant increases in government debt relative to income, to GDP. So that's kind of a framework to look at transparency, which we'll use today. Just continuing on that line of framework, I think there's different dimensions, I would say, to policy transparency. And there's really two broad dimensions the way I look at it. One often is when people talk about open government, and this is the quote from David Held, the University of Glasgow. Principle of enabling the public to gain information about the operations and structures of a given entity or policy. So often, and we hear governments now have open government policies. So a lot of this dimension is very outwards of government. So governments are putting things online and they're making their stuff available. We are certainly seeing that, with the almost daily announcements of new programs. I think yesterday there was an announcement for agriculture, and so in days past for various other sectors. So again, people know to go to government to get this information. And then there's the inwards component, which is just another way of looking at it. People are on the outside looking in, and they're trying to figure out how am I eligible for the emergency response benefit? Is my small business eligible for a wage subsidy program, et cetera? So that's the open government dimension. The other dimension is where the consultation communications way of looking at it. And one is upward. So governments want to know what's in the hands of, or what's in the minds of people. Oh, that's my dog barking in the background. So so again, we call that upward. It's an upward part of this sort of dimension. And so often we see that in pre-budget consultations. People want to know what do budgets think about. We're probably several months away from a budget, given all this uncertainty, and we'll be, that'll be fired up. And then there's the downward kind of consultations and communications. People need to be let know, basically what are governments up to. So again, we kind of look, there's these different ways of inside and outside, different directions of looking at policy transparency dimensions. So this is kind of a framework that we can use. So again, what is the value of this policy transparency? Like why, what is it really linked to? Why should we even be talking about it? And so then I just draw us again back to the quotes, draw some quotes from the OECD, from the World Bank and the IMF. And the first one really deals with accountability and trust. It's from the General Secretary of the OECD. Openness and transparency are key ingredients to build accountability and trust, which are necessary for the functioning of democracies and market economies. And later in this presentation, I'm going to come back to what have we learned from surveys about how governments are performing, and do they have the trust actually to lead us through this crisis? And so that's a key component. The second component is, again, this quote from the World Bank: transparency potentially changes the way government operates, the relationship between people and officials, and enables groups that otherwise would not participate to participate in governance. So those key, transparency affects the way governments operate, the relationship between people, and the ability for people to participate. So I think we've been seeing almost daily briefings in different parts of the world from public health officials, from political leaders. So we can see how, it's a type of transparency that is really tied to this emergency. But it is changing relationships between people, and people are getting to see the inside look how decisions are being made. So it's democracy in action. So transparency by itself doesn't guarantee performance. It doesn't guarantee accountability, but it can support it, and it changes the way people operate. And then finally, from the IMF, it takes a little bit more of an economist perspective. Transparency promotes the orderly and efficiency functioning of financial markets by making participants better informed. And so a lot of the economists will study information, particularly in markets, And there's been economists that have won Nobel Prizes for their studies of information, like Professor Stiglitz at Columbia, and and the issue of asymmetric kinds of information or market signaling, Professor Akerlof. So again, and then transparency can enhance economic performance by encouraging more widespread discussion and analysis of policies. Like, again, one thing I realized being a former County Budget Officer, if you don't have transparency, you're not really debating. And there's not enough information there to debate. So this idea that, when you have transparency, you can debate, the cost and benefits of different actions, and with the hope that we can improve performance. It enhances the accountability of policymakers and should also improve the credibility of their policies. The issue of accountability is never far from transparency. Pretty hard to be accountable with no transparency. And then certainly from an IMF or World Bank or OECD perspective, transparency can also help reduce opportunities for corruption, which exists everywhere and to various degrees. Not a major issue in Canada, but it exists everywhere. So finally, kind of getting into, okay, so how are we doing with respect to policy transparency in the case of the COVID-19 pandemic? And just start by kind of a way I think a lot of people are looking at this pandemic is COVID-19, it's one pandemic, but it's really three large global shocks. One is medical, certainly. Like, again, we get daily reports on the number of infections, unfortunately, the number of mortalities, and we get those numbers both with respect to our country, potentially our province. We get those numbers globally as well, and we know that the more workers get sick. Certainly, if we were not able to flatten the epidemiological curve, like we would have more workers sick. We less supply of workers. Definitely an impact on the economy. So a supply impact. Like with respect to the economic shock, there's really two major parts of it, and they're both significant, particularly from a Canadian context. One is just the containment. And, which we will talk about. Like we are being told by public health officials, by government leaders to stay at home. Industries have been shut down. So this has resulted in an acute disruption in economic activity. We've seen it already in economic numbers, labor force numbers, some nowcasting GDP numbers from Statistics Canada. We see it in the forecast. So this is having like an enormous both supply and demand. And I think there's a lot of concern and a lot of coverage already in Friday's announcement for labor markets data. So again, so we're seeing like a dramatic increase in the number of unemployed. The other element to the economic shock is of course commodity prices, particularly oil. In the case of Canada, all commodity prices are down, but these oil prices have plunged, which you and I know from just going to the pump. But energy producers also know this from just from their it's affecting either company bottom lines. And so this is an enormous shock for Canada. It's a big part of our industry, upwards of 10%. Of our, just a little bit less than 10% of our global our national GDP. So again, these prices are plummeted. This means incredible economic weakness for the sector and for a number of provinces. So it's really almost, again, another perfect storm, economic shock. And then finally, the third dimension to this shock is just confidence and uncertainty. Then, like, there's always uncertainty about the future. This is an incredible amount of uncertainty that we're dealing with right now. I think there's a fair sense that people know that the second quarter of 2020 is going to be a very dramatic decline. We don't really know how long the the shape of this economic recovery will look like, whether it'll be V-shaped or U-shaped or L-shaped. But it's, I think one big part of it is just our ability to be confident in the future. And will people want to go back to restaurants? Will people want to travel? Will people feel safe in their manufacturing industries? When will that be? When will that time be? Will we have to wait as long as until a vaccine is prepared? So it's, again, a framework to look at, these various policy responses. We'll look particularly at the medical and the economic ones, economic shock factors. So some observations, these are high-level observations on policy transparency and the medical shock. And to be honest, I think I'm when I both on the medical shock and the economic shock, I tend to be more positive than negative. Again, but there are these shades of gray that Uman had talked about, that's between good and bad. So, I think starting globally, the work of the World Health Organization, I think if any one of us goes to their website and or looks at the daily briefings that they're providing, the advice they're providing, the technical guidance, on the daily situational reports, the research and development, there's an incredible level of transparency. There's just enormous amount of information. It'd be hard pressed if you spend 15 minutes to an hour to 2 hours on their website to say, this is not they're not being transparent with respect to their operations of what they're up to, and there's enormous value, I think, in the work that they're doing. I think strategically, I think to the extent that most of the world, not everybody, but most of people, there's a kind of a broad consensus right now how we kind of slow the spread of these infection rates and the mortality that's associated with it. And it's a brutal measure. It is just containment. It is social distancing. But so I think to the extent that we have this relatively broad approach that is being applied to containment, that I think it's a part attribute the information is coming from organizations like the World Health Organization. There are exceptions. There's a lot of interest in what Sweden is doing, which is probably a bit more of a hybrid approach where things tend to be a little bit open, certainly a lot of protection for vulnerable people. But by and large, it has been a massive shutdown, particularly in the months of March and April. Like in Canada, if you go to our COVID-19 sites in Health Canada, I think, again, you come to the same conclusion that there's enormous amount of operational transparency, very open information flows. Again, public advice, how individuals like you and I should be taking care of ourselves, protecting ourselves, protecting our loved ones, protecting our neighbors. There's daily national and regional situational reports and briefings. There is an incredible amount of analysis that is made available, including their models that they use, the data that they are using, and so again, an enormous wealth of information. I find it pretty hard if you go on those sorts of sites, or if you listen to the briefings of our public health officials, like you can come to the conclusion anything but that they are transparent and they are open, and the information certainly feels honest. I think there's some success in Canada when you look at how these graphs that compare Canada's growth, its epi curve, but other growths. This information is broadly available. Like Canada has done reasonably well, a lot better than many of our advanced country partners. Not as well as some. We're sort of perhaps in the middle, but we've done relatively well, strategically. And so again, thank you to our public health officials for their advice. Reproduction rates are dropping, and again, just a constant barrage of data and model assessments. So, are there shades of gray in this policy transparency, between the good and the bad? And absolutely, there are a number of them. I'll just provide some of them, which we can get into conversations. The World Health Organization assessment of early transmission in China. A lot of talk about how they were a little bit late to put their finger on the human-to-human transmission that was taking place, early this year, late last year, 2019, and I'm certainly that maybe a little bit earlier we might have saved some more lives. So again, there's shades of gray. There's definitely there's been a lot of progress around the world in flattening these epi curves. We've seen some areas. For different factors, some countries, Spain and Italy come to mind. UK now is really struggling, where we really are struggling with outbreaks. There's been supply chains issues. Again, this is speaking more internationally, but affects us countries as well. And we've had these debates in Parliament by public health officials and political leaders, just trying to get protective equipment and ventilators when a lot of this comes from offshoring. Again, so are we been transparent? Why were we better ready? Is an issue. I think again, there's just evolving advice. Some of this is very natural. Again, shades of gray, but I think countries were not immediate in terms of shutting down travel. We waited weeks. There was transmission took place. We came to a different conclusion on travel. I think other issues, this simply is wearing the mask. Originally, it wasn't deemed to be that important. And now I think most parts of the world are now, making this almost mandatory, or certainly suggesting it. In our own country, we definitely have mixed performances. We have definitely seeing some spikes, and there's some higher growth than we would like in provinces of Quebec, Ontario, Alberta, Nova Scotia, that are pushing up these numbers, and hopefully we'll flatten them as well. So again, progress is not homogeneous. And then I think we're about to face some really difficult trade-off kind of discussions on reopening the economy, and what the potential risks will be as we start to open up various sectors through various phases. And this will be a challenge, a discussion that we will live with through many months. We'll need our public health officials. And again, how do you manage those sorts of trade-offs? Is another area of a shade of gray. But overall, on the issue of the medical shock, the work of public health people, both internationally and in Canada, my sense, there's been a lot of policy transparency, and it's worked. Then in terms of dealing with the economic shock, and I'll bring a number of facets together, and we'll talk a little bit about the strategy component of countries. And then we'll move into more of the operational issues of these supports. Are we being transparent on the strategy? And I think this quote, which comes from Richard Baldwin and Patrice Wetter de Moreau, which have they've edited a couple of very excellent ebooks that are on Vox EU. And so these ebooks are available to everybody, and they bring together a lot of experts to talk issues. But I think Baldwin and de Moreau kind of provide this quote with it, which I like it. They say basically efforts to flatten the epi curve, the infection curve, reduce economic activity. The recession, so to speak, is a necessary public health measure. So that's the common strategic challenge. We are effectively using a recession, containment, actually to flatten the curve. So as you can see in this chart, some of these different sort of pictures, there's on the left-hand side of the panel, flattening the pandemic curve. Again, there's that sort of standard epidemiological curve. If we don't have public health measures, we introduce containment, we flatten that curve. And containment leads to the recession, which takes you to the right-hand side of this graph. If we don't have fiscal supports or monetary supports, we're looking at a much deeper recession, and maybe we're jeopardizing the strength of the recovery. We add those fiscal supports, hopefully we soften somewhat the blow of the economic recession, and hopefully we can speed up the recovery. That's the strategic challenge. So in this case, where are the shades of gray? Again, have we all sort of bought into that? And what are the trade-off kind of issues? And so I think to me, there's a number of shades of gray, again, in this world of complexity. One is the quest for herd immunity, which is again, the way we deal with often with influenzas, particularly before we have a vaccination. This disease is spreading, and we're trying to slow the spread. So on the one hand, we've chosen to shut down economies to do this, and yet we know we can't. By shutting down economies, you're also having an impact not only in the well-being of the livelihoods of people, and mental health will become more and more an issue the longer and longer we're shut down. So it really raises this trade-off between how long can we live in this environment of containment, of really shutting down economies? When do we and how do we bring this back? And economists, we don't like to talk about it, but there is definitely work that is done on the statistical and moral value of a human life. The statistical value, people have numbers for this, and they can apply it. Actually, I think if you run the numbers, and if you look at epi curves, and I've seen some of this research, and again, you're looking at significant percentages of GDP. It kind of helps we put into perspective, again, maybe there's even economic sense, you actually provide these fiscal supports. And then, of course, the moral value of human life. And the relationship between human health and economic progress and livelihood as well. Do we really have a choice? But then again, this shade of gray, case of Sweden, which is looking at a more hybrid approach, they're trying to find, through both science and through economic and fiscal policy to find a different type of balance. There's the historic cost of a global, lockdown recession. So IMF, for example, is saying that we could shrink by 3% overall this year, where if you compare that with, that's the global GDP. If you compare that with the financial recession, we're basically flat, so much steeper. I think most people think that, with weeks and months ahead, that these numbers will get revised down even globally. I think the declines in the advanced economies are more in the neighborhood of 6% average, decline 2020 in terms of GDP. My sense is that those numbers will probably get higher as well. There is the kind of the differential social and economic impacts of containment, kind of the industry and gender impacts. Like you could see this in Canada when you look quickly at, even the labor market numbers we got for March, which showed that like some sectors like sales and retail were just devastated in as early as March, when as soon as we started putting that down. And so again, other sectors where potentially construction didn't decline so much. So you get these differential impacts. How that will play out the longer this recession is a subject of discussion. Gender impacts. We're finding, largely because a lot of women find themselves working in those types of sectors, sales and retail, they are hit extremely hard. So there's an imbalance certainly, in terms of women versus males with respect to the employment impacts of a containment strategy. The consequences of higher public debt, again, some people say we should be worried about it, other people is less so. People that argue less so, they say that interest rates are low and we could print money through quantitative easing type measures. People that say we need to worry about higher public debt, saying, we've experienced this in Canada, even with higher interest rates. It creates long-term instability. We're passing debt on to future generations. And that's a big issue because we're potentially constraining their hands to deal with tough issues, climate change, income inequality, et cetera. And then just like, there's different opinions on this, just like the strength or weaknesses of the G7, G20 commitments on the management of the COVID-19 responses. There is a communique, not everybody got behind it, it got softened. The original communique said some strong language of supporting World Health Organization. Not everybody, including the United States, believes that that's the right path to be on. So it's, again, we didn't see really tangible commitments in terms of how to manage, the public health and economic crisis from G7, G20, though you can remain hopeful. So again, that's looking at one aspect of the strategic curve. But again, I think most people know that containment means recession, and that is, unfortunately, a tool that we pretty much have to use in order to deal with the public health crisis, so we're not overwhelming our health system. These are show and tell, a couple of slides. There's been an unbelievable amount of supports from the Bank of Canada, interest rate cuts, liquidity support type programs, from the government of Canada to support households and businesses, are just in a range of, of various supports. From increasing child benefits, emergency response programs, wage subsidy programs, delaying of remittances, of tax remittances. So again, there's been support, work from the Office of the Superintendent of Financial Institutions, just changing capital loan ratios to provide additional loaning capacity. When you start to look at this, how does this impact the balance sheet? We are like a $2.2 trillion economy. The direct fiscal supports, according even to the PBO, actually in Finance Canada, probably in the $150 billion range as a percentage of GDP. That's an enormous percentage of GDP. PBO is now saying the deficit could be, with $150 billion worth of supports, could be as high as $250 billion, which was put us in the 12 to 13% range of GDP, which is a deficit that we've not seen, certainly in my lifetime. We've had deficits as high as 8% early 1980s, but this would be record high deficits. So then you go to, again, government's been relatively transparent, or institutions been transparent with respect to policy on this economic shock. Again, I think if we go to these websites on these, looking at it from a global perspective, IMF or OECD or World Bank or others, like, is there open and transparent information flows? I think when you look at what is available there, I think you have to, most of us would come to the conclusion that it's quite open, very open in terms of the provision of advice, the global country policy trackers. We use this, my students are using this if we want to know what is going on in almost any country in terms of how they're dealing with the health or the nature of their fiscal supports, or just overall the balance of fiscal supports. How does Canada compare with other countries? You can get this analysis by going to these international websites. So I definitely see internationally a high level of policy transparency. Like in Canada, I think, again, this is really almost, I think, unprecedented transparency. I go back to the 2008 financial crisis, where we did see quarterly reports from, when we were introducing fiscal stimulus, but now we've seen almost not daily, if not daily, weekly, but at once sometimes almost daily meetings of government officials, prime minister briefings in the late morning. The Bank of Canada, the governor of the Bank of Canada appearing with the Minister of Finance, providing information, taking questions. We've seen it, if you read the reports, the monetary policy report, you see the adjustments to deal with, and to deal with the uncertainty around the COVID economic shock. You see different scenarios that they're playing out. Statistics Canada, is also taking a number of measures to become more transparent. They make adjustments to the labor force survey, asking different kinds of questions, really to kind of get at the nature of the employment situation of households, people. Statistics Canada did a nowcast for March, which they've not done before. We now have some advanced information knowing on what GDP was actually in the first quarter. They're doing business surveys. So they're providing, they're definitely changing their way to become more transparent. And I think the government of Canada, with daily press briefings, these weekly announcements and new measures, you go to the website, on a lot of transparency, a big push to get legislation through. Again, that legislation is also posted. This legislation is moving relatively quickly. To me, again, as a general point, I would say, being very transparent, very open. Are there shades of gray? Absolutely. I think, honestly, from an operational perspective, it's so hard to keep for an average citizen, I don't like the word citizen, but for average, but for citizens, for even experts, you literally have announcements on a daily basis. It is just very hard to keep up. So if your economic situation is changing, you're a small business person, you almost have to stay tuned because the announcements are coming almost daily. I think you can question, do we have the balances between the supports for households, business, and liquidity? Is it the right balance? I think it's a very different balance than we saw in the 2008 financial crisis. There we kind of moved quickly to take care of the financial sector. Here, definitely a lot more balance with respect to households. But you can debate whether we have it right. I think, again, one sore spot maybe for me is that we're conducting enormous fiscal policy, unprecedented fiscal supports without a fiscal plan, with really without an economic outlook. Right now, Parliament is relying on the PBO, where I used to work, to provide economic and fiscal numbers. We don't have anything right now produced from the Department of Finance. We do have a monetary policy report that provides some scenarios, not a lot of details. But if you really want to know what economic scenario we should be planning on, you pretty much have to go to PBO with some, or the IMF to get numbers for Canada. So I think there's going to be a lot of pressure on the Department of Finance to release at least a fiscal update, I think, before the summer. And I take the great uncertainty that they live in, we all live in. I think the quick release of money can result in high incidence of program error and abuse. I think there's just, this issue, early debate of moral hazard, or fraud potentially. I think government thought, when you're telling people to stay at home, they got to move money quicker. It was going to put a lot of pressure on back-end due diligence. And I think the issue of program complexity, it doesn't apply for all programs. I think the government made an effort to use a lot of existing programs. But I challenge anybody to read legislation on, say, for example, the wage subsidy program, and say that is not complex. And that definitely slows down, I think, the whole process of getting money out the door. And I think, I think the public service is doing a terrific job. They're being quite transparent, but we haven't really systematized the release of operational data. And I think, again, I think weeks ahead, when we're putting out these historic amounts of monies, I think getting better updates of how much money is going out the door, department by department, that are providing these supports would be essential. So I'm just about at the end of my conversation. I really come to kind of the bottom line. So what is this all policy transparency, and what is this really, what does it amount to? And again, I think I'm making the case that on balance, we've seen very high levels of policy transparency with respect to COVID. And the Edelman Trust Barometer came out earlier this week. It was highlighted in the Financial Times. And I think if you go to their site, I think you see that there's a lot of trust. Trust is moving in the right direction. I think there's a record rise in government trust. And I think, in Canada, when you look, they do these 11 country surveys. Canada is one of the 11. The biggest jump actually comes in Canada. It was a 10-point jump in trust. I think they, in their metrics, any score over 60 means the government is trusted. So we've kind of moved in that trusted zone. That's a big increase from January to May. You see globally, we see increases in trust. So I think, again, this transparency that we're seeing by countries around the world, but particularly Canada, is paying off in terms of trust in government. I think in terms of finding trustworthy information, they do a polling on this. There's still people struggling to get trustworthy information, but if you look at that 11 country grid, Canada actually seems to fare the best in terms of our ability to find trustworthy information. So again, moving in the right direction there. I think, again, what does this mean? People are looking to the government. I think that's the polling numbers show. I don't present all this information, but when you compare various sectors, the role of governments, the role of NGOs, the role of media, the role of business, people are looking to the government to kind of lead us out of this crisis and get us back to normal. I think when you look at how the trust numbers are moving for expert voices, they're moving in the right direction. I mean, the trust has always been very high for scientists and doctors and national health officials, but there's been definitely some upward movements for country leaders and journalists. So I think policy transparency is a part of this movement of trust and confidence, which is going in the right direction. And finally, my last slide, I'm going to turn it over to Nicholas to get into questions. Onward Through the Fog. I bought this T-shirt when I was in St. John's, Newfoundland a few years ago. I should be wearing it right now. I picked it's one of my favorite T-shirts, and I think it kind of captures a kind of incredible uncertainty that we're living with. And so right now, these infection rates are kind of moving in the right direction, but they've come at an enormous cost. But we're still very much in the midst of this public health crisis. These numbers are, the numbers of, these infection rates that are still the number of infections is still running at very high rates, and we're seeing spikes in different parts of the world and in Canada as well. So, I think as we kind of look forward, public health policy in countries and across the globe will be focused on improving testing and tracing. I think most people come to believe that before we get a vaccine, the best ways to start opening up economies is through a lot of testing, a lot of contact tracing, and development of treatments so that we can mitigate some of the nasty symptoms of this respiratory disease or virus. I think so. Policymakers are grappling with phased approaches to reopen sections of the economy, and so there's an enormous. You can see it on the faces of public health officials. They're worried about sharp rises in infections. So we see this tension in this complex environment between public health officials and policymakers, business people that want to get things going again because livelihoods are being damaged, and there's also a lot of mental stress as well. So again, I think policymakers are going to have to look to what is a post-COVID-19 economy. What does it really look like? How does it get reshaped? And do policies need to be adjusted? And again, there's going to be, with this massive increase in debt to GDP, I think PBO is saying we can go from low 30s to upwards of 50% debt to GDP ratio just federally. There'll be significant increases in the provinces. Municipalities are in a financial crunch. They're going to be really squeezed actually to maintain services. So how do we open up these economies, and how do we provide confidence? And in a world where we don't have vertical fiscal imbalance, where provinces are strapped, particularly with healthcare spending pressures, how do we deal with this sort of tension? So I think big discussions are coming. And how do we unwind these big fiscal supports? Will we see universal basic income programs? Will we see different ways of working? I think these discussions are ahead of us, but the sooner policymakers can get up front with future directions with a potentially a fiscal stimulus program come the fall, I think the better in terms of boosting confidence. And so this issue of trust, which is I think at the end of policy transparency, this is something that needs to be earned over and over again. And I think it's hard, I'll make the case, to get this trust without transparency. Thank you very much.